Next, we have Dr. Ranjini H. Her topic is on burden of ocular abnormalities among children with disabilities in special schools of South India.
Good morning. My paper is on burden of ocular abnormalities among children with various disabilities in special schools of South India. I have no financial interest in the study. So children with disabilities, they constitute a very critical part of our population, and their assessment of vision is often overlooked because the main focus of the parents is on the primary disability. So there is a need for a very timely and comprehensive eye evaluation for this vulnerable group. So aim of our study was to assess the visual function of children with neurodevelopmental disability and to identify preventable and treatable ocular abnormalities. Ours was a descriptive, cross-sectional and interventional study conducted over a duration of 1.5 years from August 2022 to January 2024. Total 216 children from 6 special schools with various neurodevelopmental disability were examined. It is very challenging for the parents to bring these children to an hospital for an eye checkup. So we approached these children through our mobile eye clinic. Our team consisted of an ophthalmologist, optometrist, optometry interns, and caregivers. We took detailed history from the parents or teachers. We took their consent for examining these children. Visual acuity was assessed with the help of Snell and visual acuity chart, tumbling E or LIA symbols for children who were cooperative and able to respond. And in children who were uncooperative, we assessed their fixation and following behavior by CSM method. All children underwent a detailed anterior and posterior segment examination. Cycloplegic retinoscopy was done in all children. So here is a short clip of our mobile eye clinic. It's a fully equipped bus consisting of all the relative facilities and instruments required for a detailed eye checkup. Coming to the results, the males outnumbered the females in our study. The mean age group of presentation was 17.15 years, means the maximum age of presentation was in the age group of 10 to 20 years. Coming to the distribution of disabilities, the disability with maximum presentation was autism and intellectual disability, followed by speech delay and Down syndrome. The other disabilities which we noted in our study was hearing impairment, cerebral palsy, attention deficit hyperactivity disorder, Scheser disorder, and global developmental delay. There was a history of preterm birth in 21.3% of children, and there was statistically significant association between preterm birth and cerebral palsy. Coming to the distribution of ocular disorders, refractive error was the most common presentation, followed by strabismus, optic disc pallor, and cataract. In the strabismus group, exotropia was the most common presentation. We noted hypermetropia to be the most common refractive error in our study. Coming to the distribution across the disabilities, we found that children with Down syndrome has maximum presentation, followed by cerebral palsy. There was a significant statistical association between Down syndrome and hypermetropia. Similarly, myopia was most commonly present in children with autism, followed by speech delay. When we saw the presentation of strabismus, disc pallor, and cataract across the disabilities, we found that the children with cerebral palsy and Down syndrome has more presentation. Also, disc pallor was commonly presented in children with cerebral palsy. Cataracts was seen mostly in children with Down syndrome. When we looked at the association, we found that there was significant association of strabismus in children with autism. hearing impairment, and cerebral palsy. Also, there was significant association of disc pallor in children with cerebral palsy. So we rehabilitated these children with glasses. We advised occlusion for children with embryogenic risk factors, orthoptic exercises for children with convergence weakness, low vision aids was advised, and we referred children to the base hospital requiring surgery. So it has been already documented that children with disabilities are at greater risk for oculovisual disorders as compared to the age-matched control. So there is a need for an efficient ophthalmic screening and evaluation for these children. And why it is important? Because these children are dependent on vision for their personal and educational needs, and especially these children cannot come to the eye hospital for a detailed evaluation. There are various studies done in the past studying these children, but what makes our study unique is our mobile eye clinic and accessibility and affordability of eye care for these children. So if these children can't come to us for a checkup, we went to them and approached them for a detailed eye evaluation. So I would like to conclude by saying that there is a need for a community-based screening, and especially teachers who can be trained for a preliminary eye examination like assessment of visual acuity, so that the risk factors can be screened and there can be a timely rehabilitation for these children. These are my references. Thank you. Ma'am, all the children were having some neurodevelopmental disability, ma'am.
Because it's a known association.
Yes.
I mean, nothing what you have presented is surprising. You just put it. Because all these associations are known associations for many years. If you go to a special school, any part of world, you are going to find something similar. So, what is your take on it, except having a mobile van to see that?
What we noticed, ma'am, that these children were not undergoing a eye evaluation. So that was
Some of them were wearing glasses.
most of them. We had 43% of the population who had refractive errors.
No, but how many already had prescriptions?
Yeah, so there was a combination of them, ma'am. Children were there with glasses, but then many of them were not very compliant with the glasses, or they were not aware of the importance of spectacles.
And demographically, were they different? Were the children from all over South India, or how was it? Like, were they-
Mainly children from Ernakulam, sir.
Usually these centers, they don't have access to eye care, so somebody has to go and visit them. That initiative has to be taken.
Lot of times because there are a lot of, at least in urban areas, they have access to it. Maybe semi-rural areas and rural areas where the need of the hour
Especially children with cerebral palsy who are not ambulatory.
multiple disabilities.
Yes. Okay, thank you.